Hai semua, apa khabar? Hari ini saya akan memperkenalkan kawan saya, iaitu Rio.
Hai, nama saya Rio. Kawan, tahu tak apa itu demam denggi? Hari ini saya akan menjelaskan demam denggi. Apa itu denggi? Ia adalah penyakit berjangkit yang disebarkan oleh nyamuk Aedes betina. Tanda-tanda penyakit denggi: demam kuat yang mengejut, demam yang berlarutan, ruam merah di kulit, sakit teruk tulang-tulang, otot-otot, sendi-sendi dan biji mata, pendarahan di bawah kulit, pada hidung dan bisi. Marilah kita bersama-sama menonton video animasi demam denggi.
Dengue is the commonest mosquito-borne viral infection in humans. Every year, over 100 million people get infected with dengue, and around 10,000 people die from it. It used to be localized to Asia, South America, and Africa, but increased global mobility due to tourism and migrations is slowly making dengue a global disease. Dengue is an RNA virus in the family Parvovirus. It has 4 different antigenic varieties. Infection with one type provides lifelong immunity to that type, but only short-term immunity to the other types. If you get a subsequent infection with a different type, it increases the risk of developing severe complications of dengue. Dengue is transmitted mainly by the mosquito Aedes aegypti, which breeds in standing water containers such as tires, barrels, and discarded bottles. The mosquito becomes infective about 2 weeks after feeding on an infected person and remains infected for life. Symptoms appear about 5 to 6 days after the mosquito bite. Dengue can present in many ways. Some patients are asymptomatic or develop only a mild fever. In classic dengue fever, the patient gets fever for about 3 days. The fever then subsides and returns again in a couple days. This biphasic pattern of fever is called saddleback fever. Fever is associated with fatigue, skin rashes, retroorbital pain, and backache. It's also called break bone fever because of severe joint and muscle pains. Dengue hemorrhagic fever is a severe form of dengue. It's believed to be the result of 2 or more sequential infections with different antigenic types. It starts as a mild upper respiratory tract infection. Then, all of a sudden, plasma of the blood leaks into the pleural space and peritoneal cavity. This phenomenon is known as capillary leak syndrome. These patients also have low platelet levels and may develop bleeding into the skin or gastrointestinal tract and go into dengue shock syndrome. NS1 antigen testing or virus isolation can be done in the early stages of fever to support the clinical diagnosis. Antibodies specific to dengue can be identified after the initial phase of the disease. There is no effective cure for dengue, but supportive care is essential to prevent death from complications. One dengue vaccine has been licensed so far, but there are a few issues about its safety. Destroying the breeding sites of mosquitoes and applying mosquito repellents are the best ways to prevent.
Langkah-langkah pencegahan daripada gigitan nyamuk Aedes. Pertama, gunakan repellent. Kemudian, sembuh ekstra racun serangga. Seterusnya, pasang jaring penghalang nyamuk. Selain itu, pakai seluar panjang dan baju lengan panjang. Bukan itu saja, tidur dalam kelambu. Tambahan pula, elakkan berada di luar rumah pada awal 6 hingga 8 pagi atau senja 6 hingga 8 malam. Waktu ini adalah waktu punca nyamuk Aedes menggigit. Itu saja untuk hari ini. Jumpa lagi. Bye-bye. Jangan lupa subscribe dan tekan butang bel untuk video yang lebih lanjut.